In honor of Black History Month, we sat down with Access Health CEO James Michael to talk about discrepancies in the minority community and ways that they can help out.
Take a look.
Hey, what's up, you guys? So I'm here at the call center for Access Health in Bristol, Connecticut. Lots of hard-working people out there making sure that they are connecting the community to whatever health resources they need. And this gentleman right here, Mr. James Michel, is the CEO of Access Health. We're talking about very, very necessary ideas for our minority community during this Black History Month. Thank you for joining me, sir.
Thank you, Jimmy, for having me.
So why is this such an awesome time to talk about health being a factor?
Well, first and foremost, we talk about health all year round. But right now, we want to focus on the Black community because it's Black History Month. Because there's a heightened sense of the Black community to the Black community, so we want to take advantage of that energy to highlight the areas that we want to focus on to help improve the quality of health that the Black community in particular gets all year round.
So we were talking a little earlier about hypertension, there's asthma, diabetes, infant mortality, correct? These are some of the issues that are affecting the community?
Well, disproportionately. And the Black community is 5 times more likely to go to the hospital because of diabetes than the white community. And similar data for hypertension, asthma, as well as infant mortality. So we know the reason that happens is lack of access, number one, and number two, another one is lack of knowledge. So one of our goals at Access Health is to bridge that disparity gap between the Black community and the white community. And how are you guys doing that? So a lot of that's going to be done through a very aggressive and targeted campaign for the Black community, because Black community, and within the Black community, you have different layers of communities. You have people from the Caribbean, Africa, and African Americans. So each group receive information differently, in a very unique way, and process it differently. So we have to go into these communities, find out exactly how do they receive information, how do they process it, to get them to move and take action on their own behalf. All right, so after you have the access, after you've talked to Access Health, what should folks do next? What we want the community to do is, first and foremost, make sure you have a doctor. If you don't have one, we can help you find one. And also see your doctor on a regular basis and follow your doctor's instructions. Those are probably 3 key areas of focus to start the process of addressing this disparity gap between the Black community and the white community. You know, this seems like it would be a no-brainer kind of a situation, but it's very important to reiterate these ideas in a situation like this, don't you think? Right. Also, a lot of folks are new to healthcare since the AHCT came online. So now we have to do our job of making sure they understand what healthcare is and how to use it to take ownership of their own healthcare. How often do you see your doctor? I see my doctor at least once a year, and so with my kids and my wife. And I have diabetes in my family, my brothers and sisters. So they've been seeing the doctor since we were teenagers. It runs in our family, type 2 diabetes. Fortunately, I don't have it, but all my brothers do. But you've been checked and you verified that you don't have it? Every year. Awesome. And I'm one of 11, 7 boys, and 6 of my brothers all have diabetes. So they manage it through making sure they see a doctor on a regular basis, at least twice a year, and they whatever the doctor says, they do. And so far, God willing, everything has been well. Awesome. Okay. Preventative health care is the best way to go. Get in touch with Access Health ASAP.
A wonderful message from someone who is doing a lot to better the community.
Yes, definitely. Stay on top of your health. Get in touch with Access Health CT ASAP.